Hello, I'm Tracy Najwadik. I'm an MRI technologist, and I'm going to take you through the process, just the basics about what MRI is. I also encourage you to watch any supplementary type material about a day in the life of an MRI technologist, just so you can see through the actual process of what it would be like to work in this type of environment. Or magnetic resonance imaging, that's what that stands for, is a non-invasive medical imaging technique that uses powerful magnets and radio waves to create detailed images inside the body. So we're able to see soft tissue, organs, and bones as well. We're able to help physicians diagnose and monitor various medical conditions, again, without the use of ionizing radiation such as X-rays. Considered very safe for patients because of the use of the magnetic field and the radio waves generating our images. This, again, avoids the risk of any ionizing radiation used in other modalities. That makes it really special and beneficial, especially for patients requiring multiple scans or those who are more vulnerable to radiation exposure, such as pregnant women and children. MRI has been developed in the 1970s, so fairly recently, and it's been in clinical use since then, since the later 70s. But like anything in technology, over the decades, it has improved, and it's become a valuable tool in medical diagnostics research as well. We have continued advancements over the years. It's becoming more accurate, faster, and adding a wide range of applications. So at this point, there are no known biological effects as a result for prolonged or repeated MRI exams. So there has been extensive research and decades of clinical use, and therefore it's considered safe for repeat or prolonged use. So there are no known harmful biological effects of MRI scans, whether short or long term. So we're able to reassure the patients and also healthcare providers of MRI safety. So therefore, it makes it a preferred imaging modality for a really wide range of medical conditions. Side comparison. We have the first image on the left that was produced in 1977. So this is the first MRI image, and it took an amazing 4 hours to generate that single image. So when we move fast forward to today, and we've had a lot of tremendous advancements. MRI machines can produce an entire series of detailed images in just a few minutes, and not only have the increased speed, but we also have that detail clarity of the images, and it improves our diagnostic capabilities for diagnosis. So it really makes it faster, more efficient, and more of an important diagnostic tool used today in modern medicine. The advantages of MRI, so we're producing high resolution images of soft tissue structures mainly, like muscles, ligaments in the brain. So think of brain as soft tissue, correct? These are difficult to visualize in X-ray or CT images because X-ray and CT are better for bony-like structures. So MRI is preferred for sensitive areas like brain, spinal cord. So we're able to visualize precise structures without radiation exposure. So that's important for an accurate diagnosis and treatment. And again, like I mentioned a couple of times before, MRI does not use ionizing radiation, so it's safer for repeated use, again, with those populations of children and pregnant women that we want to avoid those repeat exposures. In MRI, we can produce images in multiple planes, sagittal, left and right sides of the patient, coronal, front and back, and axial, so slices head to foot in a patient. So this gives us a comprehensive view of the anatomy and pathology from various perspectives. So that's really important for diagnosis and also surgical planning. In MRI, we're able to distinguish between different types of tissue. So we have based upon water content and different molecular properties. So we're able to distinguish characteristics of tumors, inflammation, and other types of anatomy. So we're able to see the differences in those. Also, advanced MRI techniques such as fMRI or functional MRI. We can assess brain activities, blood flow dynamics, and tissue perfusion. And this gives us insights into neurological disorders and certain cognitive functions. By side comparison, on the left is a radiograph, which think of a standard x-ray of the lumbar spine. So this is a basic lateral view, and it's showing the alignment of the vertebrae, general bone structure. However, it lacks the ability to clearly visualize the soft tissue, what MRI is known for. But radiography is excellent for looking at these bony structures. But if we're comparing it to MRI, we're missing some subtle pathologies. So in contrast, we have that MRI image on the right. This is also of the same area, the lumbar spine, and it gives much more detail, particularly in those soft tissue areas. So we can see intervertebral discs, spinal cord, nerve roots, and these are not visible on a standard X-ray. So in comparison, when we're looking at these two, the MRI image reveals pathology in the disc area, so such as disc herniation or degeneration, as well as changes in the adjacent vertebrae, which are not seen in the standard radiograph. Comparing MRI versus CT, CAT scan. So I already mentioned how MRI is best for soft tissue differentiation. You can see the differences between the two right off when we're looking at the brain. And when you look at the CAT scan there on the left, you can also see the bone of the skull showing as a bright white. So these are both axial views. So these would be head to foot images, slices of the brain. We have the CT on the left. This is the X-ray. And that creates detailed images of the bone structures and acute hemorrhage. Great thing about CAT scan, it's very fast. It's very useful in an emergency situation, but it offers limited soft tissue contrast. So if a physician wanted to look really closely within the soft tissue structures there of the brain, they would probably move on to have an MRI. So on the right, you have the MRI image. Again, we're producing these MRI images with the use of magnets and radio waves, and produces highly detailed images of soft tissue structures. Now, unlike CT, MRI can differentiate between gray and white matter structures in the brain. We're able to see cerebral spinal fluid and more precise visualization of these brain structures. Through some various applications or what we're scanning in MRI, what types of studies do we do in MRI? And what are we looking for? So here we have some brain imaging. We're able to look at the detailed images of soft tissues within the brain, high resolution images to diagnose various brain disorders, making it really valuable for neurology and neurosurgery. I mentioned functional MRI or fMRI. So this is a specialized type of MRI to measure and map brain activity. So it works by detecting changes in blood flow and oxygen levels in the brain, and they correlate or correspond to neural activity within the brain. So when a specific area of the brain is more active, it consumes more oxygen. So the fMRI can detect those changes and allows the physicians to see which part of the brain are involved in different tasks. So this is used in both research and clinical settings to understand brain functions, investigate neurological conditions such as planned surgeries. It can help identify important functional areas such as responsible for speech, movement, and different sensations. And that could be really important for pre-surgical planning just to avoid any critical brain regions. It's also used for cognitive neuroscience research. It helps scientists understand the neural basis of behavior, cognition, and emotions. This is also a non-invasive way to study the brain in real time and gives valuable insights into the workings of the brain. MRI is essential in spine imaging for diagnosing herniated discs, spinal injury, spinal tumors, and it also gives detailed images of the vertebrae, spinal cord, and surrounding soft tissue structures. We're enabled to evaluate nerve compression, inflammation, and structural abnormalities. Just because of this is a great visualization of spinal anatomy, it's ideal for looking at spinal health, planning any appropriate medical interventions. MRI is valuable for diagnosing sports injuries, joint disorders, and bone abnormalities. I mentioned that it's best for soft tissue structures, but you can also see bone as well here. In sports medicine, think of knee injuries. We're diagnosing ligament tears, such as the anterior cruciate ligament, or you might hear of ACL, meniscus injuries, cartilage damage. And again, if we're able to see what's happening, that helps the radiologists report to the ordering physicians, orthopedic surgeons for treatment and planning, and also even just to monitor recovery. We're also to see arthritis, so we can even detect early signs of arthritis. We can see changes in the cartilage, also bone structure, and inflammation. So again, that can help with planning strategies. And we're able to look at tumors, also soft tissue mass within the extremities. We can distinguish kind of, not exactly, but what looks more benign versus malignant tumors. Those would need to be sampled to definitively determine that. But this also helps guide surgeons in planning precise tumor removal strategies. So scan the pelvis. We're looking, so on the left we have a female, and on the right we have a male. So we're looking at prostates in males and uterus in females. This just gives a good, since they're both, again, soft tissue structures, we're able to look at any type of abnormalities such as prostate cancer or uterine fibroids in a female. Again, with accurate planning, we can see what's happening inside the body, and that would give a diagnosis for the patient in planning for future interventions. Viewing the abdomen and abdomen imaging is valuable in MRI. We do a lot of these types of studies. We're able to assess organs like the liver, kidneys, intestinal issues with the patient as well, so we can look at the intestines. This gives detailed, detailed diagnosing conditions such as liver tumors, kidney stones, and inflammatory bowel disease such as Crohn's disease. So again, MRI is excellent for soft tissue structures. So since these are soft tissue structures, we're able to see these very clearly. Geography is used to look at blood vessels in the body, and we're not without the need of any type of invasive procedure such as catheterization. It gives the detailed of many types of arteries and veins through the body, including brain, heart, and peripheral circulation, so the extremities. Non-invasive, and it gives a diagnosis. It helps the physicians diagnose what is exactly happening in these areas, looking at stenosis, which is narrowing of the blood vessels, aneurysms, vascular malformations, and it's advantageous for the ability for 3D imaging with high spatial resolution. So that just means highly detailed. This can give an accurate diagnosis and treatment planning, and also for monitoring patients' vascular health. We also do cardiac and thoracic imaging in MRI. So in cardiac imaging, this gives detailed images of the heart structure and function and blood flow. We're able to diagnose heart diseases like myocardial infarctions, cardiomyopathies, and assess treatment responses and aid in surgical planning. Again, think of the heart, it's a soft tissue structure. So we're able to look at that really closely. So this helps give a comprehensive imaging capability. So when we think of breast imaging, we think about mammography and also ultrasound, but breast MRI is used alongside of these two, mammography and ultrasound, to evaluate breast health, particularly in patients in high risk categories, those with very dense breasts, those who are genetically predisposed to breast cancer, or patients with a history of breast cancer. So MRI, breast MRI, detailed help detecting breast cancer, assess tumor characteristics, and determining the extent and spread of disease. So if a patient were known to have a breast cancer, on one side of the breast, we might do an evaluation of both breasts before treatment planning begins. So here we see some babies. Ultrasound or DMS is known for imaging fetuses, but also MRI is used for fetal imaging as well. Again, because of the non-invasiveness of MRI and the soft tissue structure. So we're able to see inside the fetus inside the womb. And we're not doing this on a general screening basis. Once a determination is found for further assessment following ultrasound, say abnormalities are seen on an ultrasound, they would be referred to have an MRI fetal assessment study. So we're able to look closer, detailed of fetal abnormalities, assess fetal growth, and then just help guide prenatal interventions if needed. Again, soft tissue structures, we're able to see organs in utero. And this is a complement to ultrasound. It just gives more insights. So it just helps the physicians and to determine with parental counseling. 3D imaging uses images from CT and MRI to create detailed three-dimensional representations of anatomical structures. And these computer techniques give clinicians, physicians, enhanced spatial visualization to help diagnose and treatment plan for surgical interventions for complex studies. So it helps determine that complex anatomical relationship between abnormalities and adjacent structures. So here you see an image of a brain tumor, and the use of 3D imaging in modeling is removing the areas that you don't want to see and highlighting the areas that you want to see. And these can even be printed with a 3D printer. And these are used to discuss treatment options with the patients, and also for physicians and surgeons to kind of get a closer look at what is happening. Because as cases get very complex, it's hard to determine what they're actually seeing. It's better to have it in a 3D model. MRI contrast agents are used to enhance the visibility of certain tissues or blood vessels during imaging, and they help distinguish between normal and abnormal tissues. And this gives us more diagnostic accuracy. MRI technologists are trained to perform venipunctures and to safely administer these contrast via intravenously. We're able to get optimal imaging quality, and we're also worried about patient comfort and safety. So we know how to do this appropriately. Here's a couple images below. You can see before, this is an axial slice of the brain, so head to foot. And then you can see at the top of the image, those are the part of the eyes. So we're right kind of in the middle of the brain. And you see before contrast and then after contrast. And you can see the areas that are highlighted with the where contrast has gone. Also, contrast is known to go in certain areas that are following a certain path, but also when they're in areas that they shouldn't be, that is a abnormality that the physician would look at closer. So you can see that little circle with the arrow, that is an abnormality. And also over on the side of the eye with those other two arrows, those are areas of abnormal growth. I'm just going to go through the various types of MRI units that we have in MRI. Closed MRI unit. This is a standard type of MRI scanner, and where the patient lies inside there like a tunnel-like, surrounded by a large magnet. The patients may be less comfortable for patients who are claustrophobic, just because it's a little bit more enclosed. And this is the standard machine that you would see in a hospital or clinic site. Here's an example of an open MRI, and this offers, it's just more spacious, less confining environment compared to the traditional one that I just showed you. It accommodates those patients who are claustrophobic or those who require more room during imaging due to their size. These are less common and sometimes can often only offer like a lower field strength, so they might not be as strong. Niche machine. A niche typically refers to just a specialized MRI system for certain applications. This one is focusing on extremities for joints. Think of joints, shoulders, ankles, feet. These are great, especially if the patient's claustrophobic, it's more comfortable. And this would be, you'd see something like this in an orthopedic office, just because it's tailored to that specific need. A different type of niche machine, and it's used in veterinary medicine. And it's just, again, tailored for imaging animals. And it can accommodate the size of anatomy for various species, image joints, organs, and aid the veterinarians in diagnosing any type of MSK or neurological disorders and soft tissue abnormalities in pets and other animals. But also MRI is used for pet imaging, animal imaging, and they often use standard MRI scanners. We have a mobile MRI unit. What makes this unique is it's transportable, and it's the whole entire imaging facility housed within a specially equipped trailer or vehicle. So it allows for the MRI scanning to be brought into hospitals, clinics, or remote locations where access to traditional MRI facilities may be limited. They're also used to provide on-site services, just for convenient and timely access to scans for patients without requiring them to travel to a fixed imaging center. Also, these are used when a facility is building a new scanner, and they might use this as a temporary solution. MRI is also used in research. So this is a specialized facility equipped for advanced MR scanning and is dedicated to scientific studies, clinical trials to look at new applications and technologies and techniques in medical imaging and neuroscience research. Talked about the positive things about MRI, so I just want to discuss some of the things to overcome an MRI or the setbacks. They're loud because of the rapid switching of the magnetic fields within the scanner, which are called gradients, and they induce vibrations within the metal components of the machine. Uh, it's really loud noises, often can be described as banging or clicking sounds as a result of these vibrations. Now, the noise is also known as acoustic noise, and it can range from 80 to 130 decibels during scanning. And that's comparable to noise levels of a jackhammer or a chainsaw, around 100, 110 decibels. So this noise level is significantly louder than everyday sounds that we normally hear, like in conversation at 60 to 70, or city traffic, 70, 80 decibels. To reduce this acoustic noise, we provide hearing protection for patients undergoing scans. We have earplugs, headphones to reduce the loud noise generated by the machine. They help to reduce that exposure number, those higher decibel levels during scanning, to offer, so it's more comfortable and to protect patients' hearing who are undergoing these type of procedures. So we have the earplugs, and then we put the headset on top. We can communicate to the patient through that. And also pediatric patients, we have these ear covers as well. Safety consideration in MRI is from that powerful magnetic field, and that can attract certain types of metallic objects known as ferromagnetic objects or metal. And this is a risk of injury or equipment failure if these were brought near the scanner. So again, MRI scanners operate continuously and their magnetic field is always on. So we need to be really careful and follow safety protocols to prevent any type of accidents related to the safe operation of the MRI scanner. So again, the scanner is always on, the magnet is always on, so we have to consider what we bring near the scanner that would be attracted to this very strong magnet. Extremely important. No one may enter the MRI suite with implanted metal ferromagnetic objects that may interact. They may be strongly attracted to the scanner's field and could be a risk of injury. So it's important to also have patients, staff, visitors empty pockets. Avoid bringing anything into the scan room that could, like scissors, they could become dangerous projectiles. So everyone must undergo a metal screening process to make sure they're free of metallic objects in or on their body, and also ensure the safety of both individuals and the MRI equipment. Part of the safety process is metal screening. So every person that enters the MRI room must be screened for possible metal in or on their body that could affect their health and safety. So students would be initially screened before entering the MR environment, and students are reminded to let staff, MRI staff and faculty know if there are any changes to their to what they have answered on the metal screening. MRI uses 4 safety zones to manage the varying levels of magnetic field strength around the scanner and ensuring safety by restricting access to these areas based on the potential risks posed by the magnetic field. So you can see it goes from green to yellow to orange to red, and as you get closer to the scanner, it goes from green to red. So these are just the safety precautions that we have in the MRI department. These images show the controlled access to, as we get closer to the MRI scanner, and they mark restricted entry points. Controlled access is really important for MRI environments to prevent any unauthorized personnel or patients with ferromagnetic objects from entering there, potentially causing a hazard. A couple times, but what a projectile is in MRI refers to a ferromagnetic object that can be attracted to the strong magnetic field of the scanner and become airborne. So think of something that becomes airborne that's metal, that can be a serious risk. And for anybody in that path, when you have a smaller object like a paper clip, that could be pulled at 45 miles an hour. But also when we talk about a hospital bed or anything larger, that force is much greater. Aftermaths following an MRI accident, bringing a ferromagnetic object into the scan area. So it could, severe consequences if we're bringing these into the environment. So we see the oxygen tank. It was brought into an MRI scan room, and this is again against their safety policies, and it was violently pulled towards the scanner, pinning someone to the machine. And this just really shows the severe risks of especially not following policy. Another instance, hospital bed, not designed for use in MRI, was brought into the scan room, and it again became a projectile, and it was attracted to the scanner. And you can see how it's elevated above the ground, so it took flight at an alarming rate, and it is stuck to that scanner. The roles of the MRI technologist. So I just went through MRI safety, so you can see how really important it is to follow MRI safety protocols. So that's a big important part for an MRI technologist, to make sure everyone is safe. We also are involved with patient care, make sure that we're able to communicate with the patient. We are able to scan the patient, get them into proper positioning. We are responsible for also, some studies have contrast. We administer IV contrast agents to have more information for physicians. So we would also learn venipuncture. We also learn various scan techniques, so we can adjust according to what needs to be seen on the image or what's happening with the patient. And we employ post-processing. So we're using the computer after we obtain our images to make them look different in various ways. And also we care for the equipment. We do quality assurance, quality control checks, and we just make sure everything's working properly and report to or fix whatever is needed. To really excel as an MRI technologist, soft skills are really important. Passion and dedication drive them to deliver those precise, compassionate care to patients. Clear communication, make the patient feel at ease, and not to mention the ability to obtain a proper metal screening and history. We want to be attentive. We want to have safety, because we have a lot of safety things to follow. We want to have accurate imaging, positivity and empathy. So we want to build that, foster that trust and comfort during especially during stressful times for the patient. Patience, for accommodating a diverse patient needs. You might have small children, elderly, critically ill. Reliability and flexibility. We need to adapt. We need to be able to adapt to schedules, emergencies, and then finally, critical thinking for technologists to troubleshoot technical challenges, opportunities in MRI. Mainly, when someone goes into MRI and working as a technologist, generally they're working in hospitals or clinics. Also, there are mobile unit companies, veterinary clinics, coil companies that make parts of the equipment, contrast companies. You can get into management, You can become a technologist and move your way up. Also, you can be an instructor at an imaging school, involved in research or a 3D lab. I showed that 3D with the brain example, with the brain lesion. Also applications, someone who goes in and teaches technologists how to use the scanner. So once you're a technologist, you could work for a company. And if a hospital, say, purchases an MRI unit, you could be the person who goes out to teach them how to use it. And also engineering companies, you can move into learning how the machine works and get training through that. Also, a lot of people who've gone into imaging in recent years have gotten a year or two of experience working in a hospital or clinic and then moved on to traveling. So that's very lucrative. Technologist, there is a national certification by the American Registry of Radiologic Technologists, ARRT, and that is an exam. Once a student finishes the adequate clinical and educational didactic learning, they would be eligible to sit for this exam. That is the MRI ARRT board's exam. Also related to MRI is a new credential since 2015, and this is a credentialing specific for MRI safety, and this is the American Board of Magnetic Resonance and Safety. That is not necessary to be an MRI technologist. You'll see managers would have something like this. The list of fees for these boards would be the ART would be the only required board to work as a technologist. And this, changes not too often, but right now it is $225. And for the safety board, it is $350. Thank you, and do not forget to check out videos about a day in the life of an MRI technologist. I think that's also helpful, so you can see real videos of what it's like in an MRI department.